Nutrition and dietetics as a profession entails acquiring knowledge in the area of food and health. That same information is applied in people who have different conditions, particularly communicable diseases that are quite common in our country and even globally. My name is Mary Hellen Wanjiku. I'm a QA officer in JFC Munene College. I'm also a professional nutritionist and dietician with 10 years experience. For one to join JFC Munene College in the profession of nutrition and dietetics, one should have at least attained a D, that is for the certificate level, and a C minus for one who wants to do diploma. So the areas where our students can work in, we have quite a number of them in hospitals. If you are dealing with clients who are unconscious, or the clients who are probably in the ICU, then you have to come up with regimes, special feeding methods, so that you are able to assist the patient to survive. Because nutrition is quite important for everyone. Basically, nobody can survive without nutrition. So we are looking at special methods, special feeding methods like tube feeding. Tube feeding is through tubes, depending on where the insertion will be done. It also includes providing food through the veins and so forth. Some can work in NGOs. You're also going to assess the nutrition status of the people you're dealing with. You're going to advise clients. For example, you might get children who have marasmus, kwashiorkor, and they are supposed to be given special foods or special feeds, which we call therapeutic feeds. Others can work in wellness programs. Others can also be consultants, as long as they continue with their education and progress further. Some can also work in food industries. So we have, particularly seen KNDI, which is our professional body, really trying to endorse food products. And these food products have been allowed, or they've given the mandate to be out there and looking at also issues of hygiene and issues of safety. Others can be just self-employed, meaning with the information that one has, can look for people or clients or patients. It includes assessing the nutrition status, coming up with a diet plan, and follow-up to make sure that whatever, depending on the condition, that you're able to manage your patient and your client. So basically that is what a nutritionist does, depending on where they are working. Why JFC? The environment is quite conducive for any student. We are licensed with KNDI and we've been accorded the mandate. So anybody who graduates from this institution will have a chance to work with other professionals. In our institution, we also allow students to have vast experience in the clinical field. We offer what we call clinical rotation or practical hours, where our students get exposed to the kind of work other professionals in the field are doing. So as the students learn, we allocate different hours where the students can go and practically learn what is done. For example, we would choose a hospital and then we alternate in different areas. We teach students. We don't only depend on the knowledge, but we are very careful to also expose our students to our practicals, even if it's practicals within the institution. There are so many practicals that we are able to do, so that our students don't only have the knowledge, but they also experience the skills, so that they are able to practice outside there when they graduate. Now, I'll also say that we have professionals, trainers, who are doing a great job, and they give the student an overall experience which they are going to enjoy.